In January of 2021, I had a watchman put in my heart. In March, I had a scope procedure to make sure it was still in the right place. As can happen, my esophagus got perforated. I went home and had breakfast about 8 o'clock in the morning, and by 2 o'clock I was really, really ill. So I was in the hospital on antibiotics for a week, and then pretty strong ones for another week, and then I was told I was okay. On May 8th, we drove from Billings to Great Falls to watch our granddaughter pitch softball for Billings Senior against Great Falls High.
Rick drove all the way up here, and we went to the ball field, watched a half of a game, and then decided it was too cold outside and we should sit in the Suburban, so he drove around to the back side of the field, and we parked, and I jumped in the back seat with Elaine because that's the only way we could see because of the way the car was parked, and Rick's sitting in the front, and he's joking because our granddaughter's now pitching the second game, and her mom calls, and he's teasing her and saying that Riley's really stinking up the game, that she's not pitching well and giving her a hard time, and I told him to knock it off.
I was talking to our daughter about the granddaughter pitching, joking a little bit, and that's the last thing I remember.
And so second inning starts, and all of a sudden he gives 4 snorts, his head goes back, and my friend looked at me and she said, "Did he just go to sleep?" And I said, "No." And I reached around and felt his chest, and there was no movement. She dialed 911, I dialed 911. She got through first, and then I all of a sudden had the brainstorm that my goddaughter Stacy Griffin and her husband Shane were there, and Shane's a respiratory therapist, and so I dialed Shane's number and I yelled at him, "Shane, Rick just had a heart attack, get out here now."
And I don't know, you just immediately react. And when I got there, I opened the door, and Rick's wife, who I didn't know it was Rick at that time, was sitting in there, and I says, "Is he all right?" And she said, "No, he's not." And I tried to get a pulse, and I don't know how you can find a pulse when adrenaline's kicking through you. And I couldn't find a pulse, but he was slumped over the steering wheel and kind of pinned underneath it. And I just looked at her and I said, "We got to get him out. We got to get him on the ground. And we got to start CPR." And I started CPR immediately on him. In the very first push, I felt his sternum go. But that you just do what you have to do.
Rick was not coming around. It wasn't doing a lot of good.
He was blue, completely blue in the face. There was no motion, there was no pulse, there was no breathing, there was nothing. But I thought, if we keep this going, we can at least keep the blood going. And I can remember you could hear the sirens at a distance, at a long distance away. And I kept saying, "Geez, please get here. Get here as fast as you can."
They ended up using the paddles 4 or 5 times there. Finally did an epi in his leg, and that's what started his heart. They tell me that his heart stopped one more time in the ambulance. They got him back in there. They worked on him for a couple hours. They zapped him at least another 6 times, so they really went above and beyond trying to keep him alive. His heart stopped again one more time. He got zapped again, so we figure about 12 times, and they figure he was dead for about 19 minutes that day.
For 10 days in the hospital at Benefis, I don't remember anything except they kept me alive. So I remember that they tried to wake me up. I don't remember anything that happened or what anybody said. And I really, for the 15, 16 days I was at Benefis, I only remember about the last 3.
I don't think there was anybody in the family that thought he would live.
My papers when I entered the hospital said deceased due to heart failure or something. Anyway, I was entered as being deceased.
They figured out finally that his core temperature was 104 when his skin temperature was normal. So then they really knew they were fighting an infection. The whole family wanted to know if he saw any lights. That was the big discussion in there of family and everybody. Everybody worked really, really hard to keep him alive and to get him back on his feet. There were a lot of doctors that were really good with him, excellent nurses. They kept really good care of him. And then we spent 5 days down on the next floor, and he finally got to go home.
And so the rehab was not real difficult, but the main thing was I was alive. And most people, they tell me, wouldn't be. The chances are so slim of me living through that how can you not be grateful? And especially for the people that showed up to help at the time, and then what they did at the hospital here. You know, I'm very grateful I have a second chance. I don't want to blow the second chance. But it was this hospital and the staff that made it work.